I think that people are generally going through quite a bit. They are under severe stress. I think that people are generally going through quite a bit. They are under severe stress. There are individuals who are able to cope because they probably have someone that they can talk with, or they are in a position where maybe they're doing therapy and they have that support system. But there are a number of individuals that appear not to have that support system, and they may start engaging in behaviors that are negative or counterproductive, or behaviors that are not positive towards others, or even towards themselves, so they harm themselves in the process. And what we are observing is that in some instances, a number of individuals, they may be involved in sabotaging their relationships with others because they're under extreme stress. So it's a way of acting out, not in a positive way, cry for help at times, and because not knowing how to do it or how to ask for help, they end up in a situation where they may push individuals away, and it's really not their intention to do so necessarily, but it is that they're finding it really a challenge to say or use words such as "I need help," "I need someone to listen to me," I really don't need advice really from you, but I just need to have someone to make that human connection with, so that I can feel that I'm being heard, because I'm not feeling like I'm being heard, and as a result, I'm experiencing extreme stress. So we are seeing that in our society, especially where a number of persons, they might be quote unquote locked down, or they might be restricted in their ability to move around because of maybe the sickness or diseases that is out there. So these are a few tips that if you know of know of a person or an individual who might be experiencing this kind of stress, or where they are really acting out, they are behaving irrational. In some cases, it might be that they have a clinical disorder such as depression or bipolar, and they may have that diagnosis before, but because of being locked down or restricted, the symptoms are being exaggerated, or the symptoms are rearing its head even more so now than ever before, especially if a number of individuals who might be on medication, and at this present time they're not taking their medication. It can be very much a challenge for them to cope with what is going on in the world at present. The encouragement is, if a person is on medication and you're not taking the medication at this time, maybe you were diagnosed with bipolar, or you were diagnosed with depression, or you were diagnosed with any mental health issue that requires that you take medication. The encouragement is that at this time you really consider either going back on the medication if you came off, or if you are taking the medication right now but it is appearing not to work the way that it used to, because of the increased stress that you have to now contend with, you will definitely, or you should definitely, talk to your mental health provider, guidance counselor, psychiatric social worker, psychologist, or psychiatrist, or the individual who may have prescribed the medication for you. You should definitely go back to the clinic or the hospital and let them know how you're feeling at this time. I'm going to give some tips so that if you are a friend of a person who is experiencing extreme stress, or maybe they're going through one of their depressive symptoms because of bipolar, or they may be diagnosed with depression, these are some of the things that you can do that might be able to help them to treat with what they're experiencing, their emotions, their feelings at this present time. So one of the things is to listen to that individual. Listening is so important. Sometimes you may hear a person say that, "I don't feel like persons are listening to me. I don't feel like I'm being heard." And it can be that it's not that individuals or people are not listening to them, but it can be that they just don't feel like they're being heard. And if they don't feel that they're being heard, then they may feel that the world is against them, the world doesn't care about them. So it's really a cry for assistance. So you being a friend to that individual could now try to listen very actively. Now, listening is takes a while for a person to develop a skill or understanding of what listening is all about. So with listening, it takes a little while to develop that skill, because sometimes we're so quick to offer advice, or we're so quick to offer suggestions as to what the person should do, should not do. And sometimes it is not that the individual doesn't know what they should or should not do, but it might be that the individual simply is going through a depressive phase, and they want us just to listen to their rants, listen to their complaints or their difficulties or their challenges. So listening is so important, and when we listen, we should be listening not just to give advice, but to ask questions. We give the individual the opportunity to express or explain themselves, and for them to hear what they have in their minds as their reality. So listening is really about being in a position to sit back and listen to the words, listen to the phrases that your friend is using, and see if you can attempt to clarify statements so that they themselves can hear how it sounds to them. Another thing that you can possibly do to help your friend who might be experiencing a depressive symptoms or is under extreme stress because of situations, and maybe it's because they lost their job, or probably because they are in school but they are not able to meet with their classmates or meet with their lecturers, and probably they have to do it over some kind of electronic means at this time. One of the things you can do is to show empathy. Now, empathy really has to do with trying to identify that feeling that your friend is going through. It's not always easy. Sometimes we may never have experienced that feeling to the depth or to the degree at which our friend is experiencing it, especially if our friend is diagnosed with depression or bipolar and they're going through a depressive symptom. If we have not been diagnosed with depression, then it might be a little challenge for us to actually know what it feels like. So empathy is about trying to really listen, but listen with the view to see if we can feel what they're feeling, to see if that feeling is something that we can understand. And in feeling that way, allowing it to stay with us for a little while, we can ask a question such as, right now I'm feeling really saddened or hurt by what I'm hearing you're saying. Is that how you feel? So you're trying to make that human connection with that individual by showing that empathy. A number of times we will have friends who might be going through their depressive symptoms, and it may take some time. It may take a while. They might be talking to us and we're hearing this story over and over, again and again, for days and months sometimes. And it can take a toll on some persons, but remember, they're going through a situation where it's taking a toll on them as well. So the encouragement therefore is to really listen, be there for the long run with that individual, encourage that individual to with words that will help them to remember some of the wonderful things that they may have done in their life. Even up until this point, we can help them to appreciate that it's true that you're experiencing this now, but you recall a week ago or 2 weeks ago or a month ago, some wonderful or great thing they may have done in their life, and try to help them to go back to that feeling, go back to what may have triggered that feeling or that emotion, that behavior that they may have engaged in, and try to help them to mentally walk through that behavior to see if they can rekindle some level of feelings, and as a result move away or move a step away from the depressive feeling. Of course, if a friend starts talking about feeling suicidal, feeling like hurting themselves or harming someone else, those are things that you want to take seriously. So you want to tell someone, you want to tell a counselor, a guidance officer, social worker, you want to report it to the hospital so that your friend can get the necessary support that they will definitely need. So people are going through a lot, especially in this time. They're experiencing some real challenges, some emotional pain. But just being there for each other, as well as offering that supportive listening ear, being empathetic, trying to feel what they might be feeling and experiencing, so that we can be in our rational mind, offer a consoling word of some sort. That is what our friends will need. And of course, if it is that it's something beyond our ability to help them, and we perceive that a counselor or a psychologist or psychiatrist can help them, then make every attempt to contact that individual for your friend, because your friend might not be in a position to do it for themselves. They may be emotionally fragile, they may be afraid, they may be worried, they may be anxious, they may be distracted at this time because of the extreme stress or depression or the presentation of depressive symptoms if they have bipolar or if they are diagnosed with bipolar.